We're going to get started. Welcome to today's meeting of the California Climate Action Team Public Health Work Group. We have over 300 people registered for this event today, so we thank you very much for taking the time to join us. This meeting is co-organized by the California Department of Public Health's Office of Health Equity and California Air Resources Board Research Division. My name is Amanda Hooker. I am the Stakeholder Engagement Coordinator for the CDPH Office of Health Equity. I'm joined by Linda Helland, Chief of the Office of Health Equity's Policy and Planning Unit, where she oversees the Climate Change and Health Equity Program. And Linda will be facilitating today's meeting. I'm also joined by Bonnie Holmes-Jin, who's the branch chief of the California Air Resources Board's Health Exposure and Assessment Branch. And Bonnie will facilitate the Q&A portion later in the meeting. The California Department of Public Health and Air Resources Board collaborate to hold periodic meetings of the Climate Action Team Public Health Work Group to provide a forum for local health departments, state agency partners, nonprofits, academics, and others to discuss timely issues at the intersection of climate change and health equity. Today's meeting will feature an esteemed panel of speakers who will talk about the health impacts of wildfire smoke, along with discussing guidance, new research, and practices to protect communities. We will also provide some time later on to address questions from our attendees. But first, a few items of housekeeping. For this meeting, we have muted all attendees. However, there are two options for you to submit your questions or comments. The first will be through the WebEx chat feature, which we encourage you to use. To open the chat, you can hover your mouse on your screen where you should see a row of buttons appear as shown on the slide. And you can click on the speech balloon icon to open the chat. The chat panel should appear on the right side of your screen where you can enter your questions or comments into the text box. And our CDPH staff, Meredith Millett, and myself will be monitoring the chat throughout the meeting. You can also submit your questions by sending them to the email address that is shown, cchep@cdph.ca.gov. Your thoughts and feedback are important to us, so we will try to address as many questions as we can during the meeting. If we don't get to it, we will plan to follow up separately afterwards. Also, real-time captions are being provided today by eCaptions, and those captions should appear automatically under your chat box in the multimedia viewer, and then each participant is able to resize the captions window as you like. And we'd also like to remind our presenters today to speak clearly and at a measured pace for the benefit of our captioner. So this meeting, if you want to go to the next slide, this meeting is being recorded, and we will post that recording and the presentation slides and any other meeting materials online after the meeting. And just as a note, it can take at least a week or more for the materials to be posted. And the URL to that site where you can find those materials has also been pasted into the chat. So with that, I would like to turn it over to Linda.
Thanks so much, Amanda. Good morning. I'm Linda Helland, and I oversee the CDPH Climate Change and Health Equity Program. Our program works with our partners at the Air Resources Board to hold public meetings of the California Climate Action Team Public Health Work Group. At CDPH, we work to assure that California's actions to prevent and prepare for climate change improve health, equity, and resilience. Our mission is to build health equity, improve living conditions, and advance climate action through policy systems and environmental changes. We're glad to be hosting this meeting with Bonnie Holmes-Jin and the California Air Resources Board, and we're pleased you're all able to join us today. Before we jump into the meeting, here's a brief announcement for an upcoming virtual workshop convened by our partners at the California Office of Environmental Health Hazard Assessments. The workshop, Exploring California Climate Change Connections, What Science Knows, will be held on December 2nd and 3rd, and will explore the latest scientific evidence for the interconnections of climate change and its impacts, including on human health. It will feature presentations from leading researchers and representatives of tribes and community organizations, and will inform the next update of the Indicators of Climate Change in California report, scheduled for release in 2021. Learn more at the link shown or email climateconnect@oeha.ca.gov with any questions. Now I'll introduce our first speaker to provide some opening comments. Dr. Mark Starr was reappointed by Governor Newsom in 2020 as the Deputy Director for Environmental Health in the California Department of Public Health. Since 2012, he has led the department's Center for Environmental Health and has also been serving as Acting Director of the Office of Health Equity since August 2019. Dr. Starr is the designated State Environmental Health Director. Welcome, Dr. Starr.
Thank you, Linda. I like that photo. It looks a little better than my scruffy COVID-19 look these days. I want to thank everyone in the Department of Public Health, as well as a resources board and others that put this meeting together. It's really great to see that collaboration and broad participation in this work group. It's certainly this meeting topic is a logical follow-on from our last meeting, and it reflects the valuable ongoing collaboration across many agencies to address public health aspects of climate change. Climate change is one of the greatest threats to human health that we are all facing. That's no secret to anyone on this call today, on this webinar. It impacts all of us, and it's getting worse. We know that the populations most vulnerable to the health impacts of climate change, including those from wildfires and smoke, are often the same communities that face the worst living conditions and health inequities. This is also true for the COVID-19 pandemic that we're in the midst of, but the pandemic will end at climate change. There's no end in sight. The frequency of autumn days with extreme fire weather has more than doubled in California since the early 1980s. This year, almost 8,000 wildfires have burned over 4 million acres in the state, which is more than double than the next highest year, which was 2018. This has resulted in unprecedented levels of particulate matter in the atmosphere and widespread health impacts, nearly the entire state experiencing some smoke exposures. Exposure to wildfire smoke can lead to harmful respiratory and cardiovascular effects. The greatest risk, of course, with children, older adults, people with chronic conditions, and outdoor workers, and many others. Researchers at Stanford have estimated that between 1,200 and 3,000 people may have died prematurely as a result of wildfire smoke exposure just between August 1st and September 10th of this year. You'll be hearing much more about this from Dr. Balms in a moment, and from, of course, the others on today's impressive agenda. Here at the California Department of Public Health, we've been working in different ways to address the health impacts of wildfire smoke. This includes developing a wildfire guide for public health officials in 2019. We developed this along with a debris and cleanup guide at the request of California's local health officers following the major wildfires in 2017 and 2018. The guidance document provides information on measuring smoke impacts, forecasting, identifying subpopulations particularly susceptible to health effects, personal strategies that people can take to reduce their exposure, and other broad public health actions. It emphasizes the importance of collaboration between local public health officials and air quality management agencies. This document is in the process of being updated by Emergency Preparedness Office before the next fire season to incorporate the most current science and information. And I believe a link to this is already in the chat box that Dan has provided. We're also developing a climate change, California climate exposures, dashboard that can help communities explore data on wildfire smoke and the number of person days of exposure to heavy smoke. And we've been engaged in wildfire smoke research studies. And some examples include a study of public health impacts of prescribed burns in California under several emissions scenarios. This helps guide decision-making on the value and risks of increased prescribed burning. There's been a study of out-of-hospital cardiac arrest and particulate matter concentrations that's underway. It's an update of a 2019 study that found that out-of-hospital cardiac arrests increased with the wildfire smoke exposure, and lower socioeconomic status appeared to increase the risk. In a previous study in 8 California air bases during an extensive wildfire season in 2015, smoke exposure was associated with cardiovascular and cerebrovascular emergency department visits for all adults, but especially those over age 65. And in an earlier San Diego County, we found respiratory diagnoses were elevated during wildfires among Medi-Cal beneficiaries. Diagnoses were elevated among the beneficiaries, not the fires, of course. The results suggested that exposure to wildfire matter may be associated with infectious conditions as well, including upper respiratory infections, bronchitis, and pneumonia. And of course, we're now in the midst of a COVID pandemic and the dual effects of smoke along with that. As climate change continues to increase the risk and occurrence of wildfires and resulting smoke exposure, we need to ensure that communities are protected from the associated health impacts. And today's panelists will help to further our knowledge, expand our tools to address that challenge. Thanks for joining us, and I'll send this back over to Linda.
Thank you, Dr. Starr, for setting that context and reviewing some of the CDPH research findings on wildfire smoke and its health effects. Now, I would like to introduce Dr. John Balmes, who will discuss the community health effects of wildfire smoke. Dr. Balmes is a physician member of the California Air Resources Board, where he was appointed in 2007 and reappointed in 2011. Dr. Balmes serves as professor of medicine at the University of California, San Francisco, where he is the chief of the Division of Occupational and Environmental Health Medicine at San Francisco General Hospital, and director of the Human Exposure Laboratory of the Lung Biology Center. Thanks for joining us, Dr. Balmes.
Thank you, Linda. And just one correction, I'm no longer the chief of the Division of Occupational Environmental Medicine or the director of the Human Exposure Lab, though I had both of those positions for many years. So I wanted to, first of all, thank Mark for his opening remarks. I'm going to be showing some data that he referred to, but I most especially want to thank the CDPH leadership and especially the Office of Health Equity for continuing to collaborate with the Air Resources Board. Before Bonnie Holmesgen even joined the board, when she was an advocate for the American Lung Association of California, she and I pushed for greater collaboration between CDPH and CARB on issues related to climate change and air quality, and wildfire smoke is certainly one of those issues. So thanks for this continuing collaboration. Now, I've worked in the wildfire smoke space for 30 years, so I couldn't resist actually showing some slides. So if I could have the next slide, please. You know, I could have updated this slide with some photos from this year's fires, but given that we're almost at the anniversary of the Camp Fire of November 9th, starting November 9th, 2018, I just want to remind everyone that the fire season isn't over in California. We had fires in November and December in 2018. And this is the town of Paradise on the upper left, being overwhelmed by the fire. And then you can see the satellite photo of the smoke plume going down through the Central Valley and out the bay, San Francisco Bay. Next slide, please. And this is a slide from this summer, August 24th. I could have picked multiple days, but the red dots are all the fires that were occurring that day. But you can see the massive amount of smoke plume being generated by all these fires. Next slide, please. So as Mark already said, this has been an incredible wildfire year. 4 of the 5 largest wildfires in California history have occurred this year in the northern part of the state. And as of earlier this week, the August Complex Fire, which is officially the largest fire ever, is over 1 million acres and was still not 100% contained. As Mark mentioned, 2018 was the previously worst year in terms of wildfire. Total surface areas burned at 1.7 million acres, and we're now up over 4 million acres with 10,000 structures damaged or destroyed and at least 31 fatalities as of 10/26. Next slide. So what is emitted from wildfires that affects community health? Well, they're the primary pollutant emissions, and we focus on particulate matter, but there's also carbon monoxide, which can be a problem for the wildland firefighters immediately fighting the fire. Oxides of nitrogen, nasty compounds like polycyclic aromatic hydrocarbons, they're some of the carcinogens in tobacco smoke. And then volatile organic compounds, including formaldehyde, acrolein. And I like to think of the primary emissions from wildfire smoke as similar to tobacco smoke, shown on the right, without the nicotine. And then there's secondary air pollutants, meaning the primary pollutant emissions get transformed in the atmosphere to create other types of particulate matter and ozone. So there's actually, the emissions from wildfires are climate forcing. Not only are the wildfires partially driven by climate change, they're also they're climate forcing, so they contribute to climate change. Next slide, please. And because these fast-moving mega fires have gotten into neighborhoods like the Coffee Park neighborhood of Santa Rosa in 2017, or the town of Paradise in 2018, and various towns this year, there's also structural fire smoke, which is particularly toxic, including emissions of hydrogen cyanide, hydrochloric acid, phosgene, a war gas, various toxic metals, and solvents like toluene and styrene, and dioxins. So wildfires can cause many buildings and motor vehicles to burn, and so local residents, like in Chico, downwind from the Paradise Fire, there probably were exposures to some of these toxic materials, and certainly wildland firefighters or structural firefighters that are asked to fight wildland fires are exposed, because the Scott Air Pack that you can see with these structural firefighters can wear are not practical for fighting wildfires. So basically, the wildland firefighters are exposed to all this stuff without respiratory protection. Next slide, please. And so Mark Starr referred to the Stanford study that showed that there might be 1,200 to 3,000 excess deaths due to our wildfires this year. And here's some data from that work. And you see various metropolitan areas. And what they did was show the PM 2.5 fine particulate levels that were in excess of the background average. And so all the red above the line is excess PM 2.5, and that's how they determine the potential excess deaths. And so you can see in Northern California, including Fresno, very high levels of excess PM 2.5, so probably excess deaths. Next slide, please. So as I said, I've been involved with wildfire smoke and adverse health effects for several decades, and I was involved in this critical review of health impacts of wildfire smoke with colleagues at UC Berkeley School of Public Health and folks at University of British Columbia and the British Columbia CDC. And we did a review of the literature through 2015. It was published in 2016. And there was clear evidence of respiratory health effects, especially exacerbations of asthma and chronic obstructive pulmonary disease, likely increased risk of lower respiratory tract infections like Mark referred to, acute bronchitis and pneumonia. but cardiovascular effects were not so clear at this point. And this photo is just a teaser for Stephanie Holmes' discussion later in the program, because this is during the Thomas Fire in December of 2017 down in Southern California. And you can see how bad the air pollution was in the background. So should this family be out walking? And are the kids wearing adult N95s really being protected or not? More later about that from Stephanie. Next slide, please. So Mark referred to a landmark study that CDPH did in collaboration with the US EPA, but I have to say that the first author, Zach Wettstein, was a UCSF medical student. And they used data from the 2015 fires, and they were able to show exposures to smoke, wildfire smoke PM 2.5 in 3 categories: light, medium, and dense. And they showed the expected respiratory effects that we knew about, but they documented increased healthcare utilization at California hospitals for all-cause cardiovascular effects and all-cause cerebrovascular effects. And the effect sizes for the cardiovascular outcomes were similar to the respiratory outcomes. Subsequent to this landmark study, US EPA has published several other studies. Next slide, please. Several other studies that show cardiovascular outcomes from acute exposure to wildfire smoke. And because we know a lot about PM 2.5 from exposures other than wildfire smoke, from motor vehicles, power plants, et cetera, we're concerned about the panoply of effects that we know occur from PM 2.5. So low birth weight, there are actually some data from California from one of the San Diego bad fires of the last decade. And more studies are coming out in terms of low birth weight. Several studies are underway about preterm birth. We know about mental health effects in both kids and adults, but these other effects like increased risk of diabetes, obesity, cognitive decline in old people like me, decreased neurodevelopment in kids, lung function growth in kids, and health of pregnant mothers. It all depends on whether recurrent exposures for many days, which we're really expecting because of climate change, this year is not going to be an outlier, unfortunately. We're concerned about all these effects, but we don't yet have data for wildfire-specific PM 2.5. This is just reminding everybody, is a cartoon from the US EPA about the size of PM 2.5, which is compared here to human hair, which is 60 microns as opposed to 2.5 microns or smaller. Next slide. So as Mark already indicated, we've had this landmark wildfire season in the midst of a COVID-19 pandemic. So prescribed burns is a topic that I'm glad CDPH is addressing. I've provided a little advice to Sumi Hoshiko, who is the CDPH lead of that study. But before that study has even had a chance to provide us results, I was contacted by the U.S. Forest Service about whether they should do prescribed burns in the midst of a pandemic. They put prescribed burns, an essential tool for forest management, on hold for a while this year because of concern about exacerbated risk for SARS-CoV-2 infection and progression to COVID-19, and even recovery from COVID-19 in people who have already had it. Can evacuations be done safely? I mean, we'll probably have data coming out about that. And how do we fight wildland fires? In California, 40% of wildland firefighters are incarcerated individuals. And this is the gang-like work that these folks have done. And this year, the training camp outside of Lassen had to be closed for a while because there was an outbreak of SARS-CoV-2 infections, which caused a decrease in number of wildland firefighters available, so that the state actually had to hire some temporary firefighters to replace the prisoners. And then mega fires have traditionally been fought with these large camps, fire camps, with people coming from all over the country to help. And this is actually not very appropriate. Is tried to keep their crews in their usual pods of 20 or so, and not in these large camps. But this has affected the logistics of wildland firefighting. And then how do we protect the public is what this meeting is all about. And so I'm not going to go into this other than this is an incredibly important topic. So I think I have one more slide, just a summary. So the duration of the wildfire season is longer, and catastrophic wildfires are increasing in frequency due to climate change. So this year is the new normal. Acute respiratory effects, including risk of lower respiratory tract infections, are well documented, but new studies suggest acute cardiovascular effects. And again, thanks to CDPH for taking a lead in these studies. Long-term effects of high and/or recurrent exposures need further study. We really don't know whether kids, for example, exposed to bad air for several weeks, year after year as they're developing, will have long-term health effects. And then, of course, the nexus of COVID-19 and wildfire smoke complicates wildland firefighting. So with that, I look forward to the rest of the agenda. Thank you.
Thank you so much, Dr. Balmes. We appreciate your leadership and expertise on this topic. Now, Barbara Weller and Brian Malag will discuss the health impacts of wildfire smoke in more detail. Barbara Weller has spent most of her career studying the health impacts of air pollution. She received her PhD in pathology and toxicology from Duke University and her postdoctoral training at the University of California, Davis. She presently manages the Population Studies section in the Air Resources Board's Research Division, which is responsible for studies examining the effects of air pollution exposures on sensitive populations, including children, the elderly, and those with respiratory and cardiovascular disease, while also including other factors that may contribute to sensitivity, such as socioeconomic impacts and the built environment. Brian Malag is a research scientist with the Air and Climate Epidemiology section at OEHA, who has engaged in a number of studies on the health effects of exposures to criteria, air pollutants, and temperature. Take it away, Barbara and Brian.
Hi there, thank you. So this is Barbara Weller. Pleased to be here. I don't have a camera, so I do apologize for that. But I am going to be talking about wildfire health effects, as well as talking about the wildfire health research that is ongoing in the California Air Resources Board. So I just want to do a check and make sure that you can hear me. So can someone tell me? Oh, thank you. Thank you so much. Okay, so next slide, please. So we've heard about the new normal, the fact that we've seen increasing impacts of wildfire in California, and we've experienced one of the worst wildfire seasons in the state. We've heard about the fact that, the smoke has really impacted nearly the entire state. And in fact, as the National Climate Assessment warns us, the very nature of wildfire is changing. They're becoming more frequent and intense with climate change. And these California maps really show the projected increase in the annual average area that will be burned by wildfire. So as you can see by the darker red hues on the right-hand map, the burn area is forecast to increase over the next 20 to 30 years in California. And we've heard that wildfire is a significant producer of PM 2.5, which is one of our major pollutants of concern, as we've already heard some discussion about. Next slide. Thank you. So we've heard from Dr. Baums about the components of wildfire smoke. I think the most important thing to understand is that it's a very complex mixture, and not all wildfire smoke is the same. The particulate matter is, of course, a major component and is one of the major concerns because we know fine particulate matter can be deeply inhaled into the lungs, and the very smallest particles can cross into the bloodstream. But we know that whatever is burned produces the toxics and the components that are found in wildfire smoke. So in urban fires or in fires where vehicles and structures are burned, many other very dangerous chemicals can be produced. Next slide. And this is an example. Some of the measurements made during the Camp Fire, which we've heard about before in Paradise, as we're coming up on the anniversary of this devastating fire. This is one of the deadliest and most destructive fires we've had in California. And you can see that some of the extreme levels of PM that were measured during this fire, and these were actually, a lot of these measurements were at Chico. So it was downwind from the fire. Also, high levels of metals were measured, such as lead, manganese, and zinc. And remember, there were many structures and vehicles that were burned in the Camp Fire. Next slide. So we've already heard about the public health impacts, and you can tell from this rather dense slide that the health impacts of wildfire range from mild effects to serious effects, and we're all affected by a wildfire smoke. But it's particularly dangerous, as we've heard, for elderly, children, and those with heart and lung disease. You see emergency room and hospital visits increased, particularly as we've heard for respiratory illness, and there is a known increase in premature death. In addition, workdays can be lost due to illness, and the Air Resources Board has a study underway to examine the impacts of wildfire on work loss days, and we'll be comparing this to the effects of work loss days from other sources of PM. And it's important to remember also that these effects can be seen days after the exposure, and as we've heard, there is also an increase in the risk of infection. These effects will be worsened, as we know, by the additional stresses which people of color have to deal with. And these people are also often exposed to higher levels of other pollutants. Next slide, please. So we've heard that dealing with wildfire exposures in COVID-19 is a complication for first responders and for evacuated community members. And that wildfire smoke can also increase the burden on medical facilities dealing with COVID-19 cases. We know from previous study that a Harvard study found increases in particulate pollution over the long term was associated with an increase in death rate from COVID-19. And this study and a number of studies in Europe found a potential connection between living in areas with elevated levels of air pollution, such as particulate matter and nitrogen dioxide, and increases in COVID-19 cases, hospitalizations, and mortality. Because of this concern, CARB has 2 studies ongoing to evaluate the effects of air pollution exposure on COVID-19 cases and progression of illness. One of these studies is a statewide study, and one is using the Kaiser Permanente members in Southern California. And these studies will be examining the impacts of long-term exposure in California to air pollution using more detailed exposure methods, and will also look at the potential disparities and effects in ethnic and racial groups affected by the multiple stressors that we know these groups have to deal with in disadvantaged communities. Next slide, please. It's important to remember also that wildfire has economic impacts. The health impacts cause medical costs and also work loss days. In addition, there are high economic costs for the fighting of wildfires And of course, one of the greatest costs is from the destruction caused by wildfires, including the tragic loss of life from the fires. And remember also the loss of life from the increased risk of premature death from the smoke exposures. Next slide, please. So while we know that there are longer exposures to wildfire smoke seen in California, there are very, very few studies of long-term exposure of wildfire smoke effects, and most of these are in firefighters. As we've heard, firefighters are on the front line, breathing whatever is being produced by the smoke. They have found consistent decreases in lung function as well as increases in respiratory symptoms in wildland firefighters. And new study has found a potential link between wildfire fighting and the development of hypertension, but this is an area that needs further study. And also the increased risk of mental health concerns in wildland firefighting as they're fighting some of these devastating fires in California really needs to be better examined. So basically, the long-term impacts of occupational exposures are mostly unknown, especially when you're looking at exposures to toxics. Next slide, please. So in the summer of 2008, there were huge fires in Humboldt and Trinity County that left most of Northern California covered in a thick blanket of smoke. The Primate Research Center at UC Davis was no exception. And the outdoor living infant rhesus monkeys that were born just a few months prior to the fires, were unintentionally exposed to the very high PM 2.5 levels that were present at this time. Researchers have been following these exposed animals as they grew up and have found that as adolescents and young adults, they had impaired immune function, changes in lung structure, and reduced lung function. And we're continuing to look at this research and refine our understanding of how these early life exposures might affect these animal individuals as they continue to age. Next slide. We're also trying to investigate wildfire emissions. There is research to understand the difference between emission and control burns of different forest types to compare to wildfire emissions, and CARB in-house study will help characterize these emissions. But there's a study that will utilize NASA aircraft to examine wildfire emissions and air quality downwind of fires. And we have a study in Fresno, California, to look at the sources of particulate matter exposure. And this study will look at all sources, including traffic sources, as well as many combustion sources in residential wood burning, agricultural burning, prescribed fires, and wildfires. So the results of all these studies will help better characterize wildfire emissions and their effect on air quality, and will also help us better understand the trade-off between prescribed burns and uncontrolled wildfires. Next slide. Sorry, next slide. Thank you. Okay. And we funded a study to develop a tool, which I'm personally very excited about this tool, which will help us to assess the potential health effects of our policies to improve natural working lands. So the tool will help assess policies and actions such as prescribed burns and thinning on the reduction of wildfire, and will also help us to identify the policies that have the greatest potential to reduce health impacts from wildfire. And like most of the studies that I have mentioned, this study is just beginning. Next slide. So we've heard about what we call the new normal, which is longer and more extensive impacts of the wildfire season in California. And we need to know more about the impacts of smoke exposure. The Air Resources Board is committed to continue to research the effects of wildfire smoke lasting weeks, not just days. And we need to know more about mitigations that work. And we're going to hear more about that today. Next slide. So I couldn't resist putting in a small slide on ways that people can protect themselves from smoke exposure. Next slide. And CARB is actively engaged in outreach to limit Californians' exposure to wildfire smoke. Our website, which is kind of small on the slide, but it's right in the center of this slide, Protecting Yourself from Wildfire Smoke, provides a number of resources, including guidance and recommendations for looking at the use of masks, as well as video interviews with CARB experts. And you're going to hear more about the guidance documents today. These documents also discuss clean air shelters where residents can take refuge from high levels of air pollution emitted by fires. And with legislation, CARB is now involved in a pilot study to implement a program to create a network of clean air centers in the state. And these are intended to protect the health of some of our more vulnerable residents who need to find a place to go where they can breathe clean air during a wildfire event. Next slide. And this is just a list of some additional resources that can be on wildfire information, and I'm sure you'll hear more about that today. So thank you. Next slide. Thank you for your attention, and I'll turn the webinar over to Brian.
Okay, thank you. And so just to add to what Dr. Weller has presented, we wanted to share a specific study that we've been working on at OEHA's Air and Climate Epidemiology section. Next slide. And just to say that this, what's presented today is our opinion and not necessarily the official opinion of any state agency. And also these are preliminary results, and so they're not quite yet citable. So hopefully pretty soon, though. Next slide. Just for a very quick background on this specific event, the North Bay fires of 2017 were a multi-fire event in Northern California that started late October 8th, early October 9th, and eventually concluded as one of the deadliest and costliest wildfires in the nation. To that time point, as we've heard, there have been some pretty significant fire events in California in more recent years. Next slide. And as you can see here, air quality was heavily impacted. And especially, as also previously mentioned, given the predicted increase in these events with advancing climate change, we were very interested in how these wildfire-related air pollution exposures impacted health across the Bay Area. Next slide. And our colleagues at the Bay Area Air Quality Management District had the same thought and were able to share monitoring data for PM2.5, one of the primary pollutants of concern for wildfire. Those data were used to estimate population-weighted average exposures for each counties. And so for counties with fires actually within their borders, Napa, Solano, and Sonoma counties, you can see predictably that they had the largest increases in PM2.5 during the fire. But all Bay Area counties were impacted. Next slide. So we were able to combine that data with county-level daily counts of unscheduled hospitalizations and emergency department visits compiled by the California Office of Statewide Health Planning and Development. We tried to focus on specific primary diagnoses that had been linked to some degree to PM2.5 exposures. That includes a number of cardiovascular diseases, acute MI or heart attacks, for example, respiratory diseases like chronic lower respiratory disease, that's essentially COPD. Additionally, we looked at diabetes and mental and behavioral diagnoses. Next slide. And so the two aims for our study were to estimate short-term risks from PM2.5 in this region during our study period, scaled to represent a typical increase in PM2.5 during the fire, and to test if health outcome relationships with PM2.5 during the fire days were quantitatively different from those we see during more typical days. Next slide. And so here I just pulled out the statistically significant findings to display. We saw higher risk of emergency department visits for all respiratory diagnoses, as well as specifically for asthma, chronic lower respiratory disease, and acute upper respiratory infections. And so these results are scaled to an increase in of 23.4 micrograms per meter cubed PM2.5. That's just to represent the difference between fire days compared to a typical non-fire day. And so, for example, for asthma emergency visits, that's second from the left, we estimate almost 1.6 times the risk of an asthma emergency visit on a wildfire day during this wildfire compared to a typical day. That's approximately, essentially, 60% increase in visits. We also observed increased visits for acute MI and decreased visits for mental and behavioral diagnoses as well. These relationships were generally mimicked with the hospitalizations, though the magnitudes were generally similar or decreased compared to the emergency visits for the cardiorespiratory outcomes. And we also noticed decreased pneumonia and increased diabetes hospitalizations relative to the wildfire period. Next slide. And when specifically comparing relationships for emergency visits explicitly during the wildfire period to those solely outside the wildfire period, there were a couple findings. The relationship for asthma emergency visits was significantly stronger during the wildfire period, and the reverse was found for dysrhythmia visits. For hospitalizations, we couldn't resolve any differences between the two PM types. Possibly because of the lower numbers in that data set. Next slide. And so this summarizes what I mentioned in the previous two slides to provide a little extra context around these findings. As I mentioned, we found the strongest links between PM2.5 and respiratory outcomes, and that generally agrees with recent reviews of respiratory outcomes and wildfires in California and elsewhere. We found fewer links to cardiovascular outcomes, acute MI being the main one. And that agrees with recent reviews that show a little more inconsistency relating cardiovascular disease and wildfire air pollution. Although as Dr. Starr and Dr. Balmes mentioned, like recent multi-air basin studies in California have linked smoke-related exposures to cardiovascular emergency visits and out-of-hospital cardiac arrests. So there's still some decent evidence there. And I also mentioned that the stronger relationships with asthma during the wildfire period compared to the non-wildfire PM2.5 that we observed has been seen to varying degrees in other studies. So evidence may be building that wildfire PM2.5 is more potent than typical PM2.5 in terms of aggravating asthma. Next slide. And I just wanted to acknowledge Rupa Basu, our section chief, and our other co-authors and people who lent their support to this effort. Thank you.
Thanks so much, Barbara and Brian, for that really excellent, informative set of presentations. We really appreciate the partnership with our colleagues at CARB and OEHA. I also want to refer folks to the chat because Dan is inputting links to resources and information that the speakers are referencing. Now, next slide, please. I'd like to introduce Dr. Stephanie Holm, our next speaker, who will talk to us about new research on children's exposure to wildfire smoke. Dr. Holm is a public health medical officer in the Children's Center at Cali PA's Office of Environmental Health Hazard Assessment. She's a pediatrician and occupational environmental medicine physician and the co-director of the Western States Pediatric Environmental Health Specialty Unit at the University of California, San Francisco. Thanks for joining us, Dr. Holm.
Absolutely. Thank you for the introduction. All right, so I'm going to be speaking specifically about children and why children are particularly vulnerable. My CDPH and CARB and OEHA colleagues have all done a really lovely job of giving you all some great wildfire background, so I'm going to skip that and just jump directly into the info about kids. Go ahead and go to the next slide for me. These are just my standard disclaimers. I'm funded by a number of different people, including AAP and ATSTR and EPA over at the PACU, and I work at OEHA, but the comments are my own and do not represent OEHA, the state of California, or any of my various funding organizations. Next slide. So the stuff I'm going over today is really all from a paper that I co-authored recently with Mark Miller and John Balmes, titled Health Effects of Wildfire Smoke in Children and Public Health Tools, a narrative review. That was just published in JESSE, the Journal of Exposure Science and Environmental Epidemiology, in September. So certainly if you want more detail on really any of the things that I'm talking about today, you'd be welcome to take a peek there. But what I'm going to go over just quickly are 3 bullet points. The first is why children are particularly vulnerable to wildfire smoke. The second is which particular health effects do we have data on specifically related to wildfire smoke. And then the third is considerations of the use of respirators and masks in children. Slide. So children are more vulnerable to actually all environmental exposures, but including wildfire smoke for 3 particular reasons. Let me get to the next slide when you have a second. Great, thanks. So the first is that they have differences in physiology that increase the dose of pollutants that they receive. For wildfire smoke, the big thing here is that children actually breathe more air relative to their size than adults do. And so because they breathe more air, when we have things like smoke and other toxic compounds in our air, they breathe in more of that too. Children also have unique windows of development. They're still growing and changing. And as John Balmes mentioned earlier, we don't know what the effects of, chronic and recurring wildfire smoke exposure is going to be for children like my daughter, who are growing up in a California that has frequent wildfire smoke events. And then last, children have behaviors and preferences that increase exposure. For wildfires specifically, kids exercise more than we adults who spend hours and hours a day sitting in front of Zoom. Because they're more active and getting more exercise, they also end up breathing in more air for that reason. Slide. So a couple of folks have mentioned that there are robust data relating multiple of the various pollutants that exist in wildfire smoke to health effects in adults and children. And that's certainly true. This slide just goes over some of the data on which things have been specifically related to wildfire smoke. Certainly this is a growing field as we have more and more wildfire smoke events. Unfortunately, there's more opportunity for these things to be studied. So I'm sure we'll continue to learn more in the coming years. But at this point, there's really robust data that there are both upper and lower respiratory effects from wildfire smoke. So when I say upper respiratory, I'm talking about things in the eyes and nose and throat. So that's, itchy eyes, sneezing, sore throat, the sorts of things that probably many of us that live in California have experienced at various times over this last fire season. Those are also well established to be related to wildfire smoke exposure in children. And then lower respiratory, I'm talking about things in the lungs. So there's also clear data that there are increases in asthma exacerbations. In fact, there's enough data there that we've started exploring which populations are particularly vulnerable. That, for example, children who have increased BMI are even more likely to have worsened asthma with wildfire smoke exposure, and that younger children are more susceptible to wildfire smoke exposure as well. And there's also data relating lower respiratory infections. So that's things like pneumonia and bronchitis to wildfire smoke exposure in children. Looking at non-respiratory effects, there's been less evidence, but still some. Thanks. The data that exists so far have related prenatal exposure to decreases in birth weight, as well actually as one study has shown a higher rate of early birth, children being born earlier when they were exposed to wildfire smoke in utero. There's also a recent study out of Washington, had a huge cohort and looked at deaths related to wildfire smoke exposure. Thankfully, pediatric death is a rare outcome, and that's a good thing, but it also makes it hard to study. This cohort was really massive, and they did start to see what looks like a potential effect of wildfire smoke on respiratory mortality in infants and toddlers. I will say, that didn't reach statistical significance for those of us that are more used to looking at stats. It was a very small number of children that died, thankfully, but it's enough to be curious about it and worry if there's a real effect there. All right, so those are the effects that have been well studied, specifically relating to wildfire smoke exposure in children. Go ahead and change slides for me, thanks. And so I'm going to talk about a particular public health topic that's been discussed a lot. I think in our paper, we go over a couple of different topics. We talk about the use of low-cost sensors and how those can be utilized for making activity guidelines for children. And we talk a lot about indoor air quality and ventilation and filtration. And those are really important because, certainly improving indoor air quality has the potential, especially at places like schools, has the potential to affect large groups of children. But one of the areas where there's a lot of sort of newer information is around the potential for use of masks or respirators by children during wildfire smoke events. So I always like to start this talk with this particular slide just to sort of ground ourselves in thinking about masks and respirators for respiratory protection. That's, of course, very different than using masks as what people call source control, right? So when we're thinking about cloth face coverings for COVID, we're talking about source control, preventing my sneeze droplets from getting on you. Whereas when we're talking about masks and respirators to protect against wildfire smoke exposure, we're talking about protection for the wearer. In that instance, there are two key things to think about. The first is filtration. That's how many particles can actually pass through the material. And the second is leakage, how many particles can pass around the edges of the mask or the respirator. Slide. So using the term mask, there are two sort of commonly used masks to think about. I mentioned a moment ago cloth masks that are important currently during the pandemic. They do, of course, decrease transmission of infectious droplets. But when you're thinking about these for wildfire smoke, cloth of various types, whether that's, T-shirts that you buy or fabric that you bought at the fabric store, like I used in these masks that I made in the picture, that cloth is not designed for respiratory protection. And so there's a wide range of filtration characteristics of the cloth because that's not what we're designing these cloths for, right? And so when people have studied different cloth types, the variability is huge, even within cloth types that people would think of as being the same, right? So even if you say, oh, well, this is made from a sweatshirt or a towel or a sari, or it doesn't matter, there's huge variability within each of those categories. And unfortunately, for some fabric types, some studies have shown that PM 2.5 can actually concentrate inside the mask. So unfortunately, that can mean that not only is it not particularly effective, but it can actually be increasing people's exposure. And this is true as well in some of the available cloth masks, right? There are sort of very fancy cloth masks available, certainly online now, but also previously. And even with some of those commercially available ones, the filtration can be particularly low. Thinking about medical masks, of course, these also aren't really designed for respiratory protection, right? These came about initially actually as surgical masks, right? To make sure that the surgeon is not sneezing into the operative field. But there are more regulations. There's more standardization of the material in medical surgical masks than there is in cloth masks. And when these have been tested in NIOSH studies, the mean decreases in exposure are actually somewhere in the range of 15 to 40%. Other groups have found somewhere in the range of 30 to 60%. The material itself actually performs much better. That often filters closer to like 90%. But because medical and surgical masks do not fit tightly to the face, the decrease in exposure for people wearing these is more in the range of 20, 30-ish%. There are not very many studies that have looked at using medical masks for children to protect them. In one study out of, I believe it's the Netherlands, They assessed medical masks for a small sample of children and found that they had very similar results for the children as they did for the adults. That one actually had a decrease in exposure of about 2/3. They did have nurses securing these masks to people's faces, though, so I wonder if they had a better seal than one might expect ordinarily. Next slide. All right, and then respirators, of course, are in fact a type of face covering that is specifically designed to protect the wearer from respiratory contaminants. Historically, these have primarily been used in occupational workplace settings where there are respiratory programs and fit testing is done, and there's sort of a much more rigorous framework around those. When we think about their use in the general public, we then have to think about how these would be used in a population that would not be fit tested. In a NIOSH paper a little over a decade ago now, they showed that assessing a sample of N95 respirators that were currently on the market at that point, the 95th percentile was a 70% reduction, meaning 95% of the devices reduced people's exposure without fit testing 70% or more. Although for specific products, the 95th percentile actually ranged from 9% all the way up to 92%. So I think one of the things that I thought was really interesting reading this material was it made me realize that fit testing allows us to make sure that all products in a class achieve the protection values that we think are adequate, but it's not actually that all products need that fit testing to achieve that, which really makes you wonder if there's a possibility for a future where we would have products specifically designed to be used without fit testing. Again, fewer studies in children than in adults, but there are 2 published studies right now, and then some unpublished data available as well. So in that same study of Dutch children, a small sample of school-age children had 92 to 97% decreases in exposure wearing a non-fit tested, actually European equivalent, FFP2 equivalent of an N95. And that was very similar to their results in the adults. Most recently, there was just a study published for the first time evaluating a respirator specifically designed for children. That was in Singapore, and they were able to achieve a quantitative mask fit in all the children that they assessed. 3M, which is a US respiratory protection manufacturer, I don't have any relationship with them, but they've shared that they have some proprietary data on N95 testing that suggests that they, with intentional development for children, are able to potentially design products that could achieve the kinds of reduction that you would see in adults. All right, next slide. So there are a couple of concerns that are often raised when talking about the use or potential use of respirators in the general public. There's a lot of information on this slide, but we'll just sort of hit the high points. So the first is the concern that these products may give people a false sense of security, that if it is not fitting well and there are huge amounts of leak around the outside, people may still think that they are adequately protected and then increase their exposure. And that's definitely a concern. I think it really argues for us as a public health community to do a really good job with clear communication, helping people understand what kind of exposure reductions can be expected, and also that even if you're hoping to reduce your exposure using one of these products, that you should still not put yourself in harm's way because of that. From a safety perspective, most of the work has been done on healthy young adults, but the overarching summary is that certainly there are some subjective increases in things like facial heat and moisture, but that if you look at objective measures like heart rate and breathing rate, most of those stay within healthy adult ranges, even when people are wearing respirators for quite a long period of time. There have been studies in nurses wearing these for 12-hour shifts, and they tolerate these quite well. The only study that has done similar testing in children is that one that I just mentioned out of Singapore, and they also found that the children tolerated the N95 respirators quite well. I would also say that, in a sense, we are currently running a giant experiment all over the world with children wearing masks. And, certainly so far, kids seem to be tolerating that fairly well. Slide, please. People who are used to thinking about respirators from an occupational health standpoint or an industrial hygiene standpoint often get really worried when we talk about the use of respirators without fit testing. And so this is just a little graphic that we developed over at the PACU to sort of help people think through why these could still be helpful even in the absence of fit testing. So on the far right, you can see that if you're put in unhealthy conditions, whether that's at a workplace or because of wildfire smoke, a fit tested NIOSH N95 certified mask is going to reduce your exposure 95%. And that'll take you from the unhealthy range of exposure down to the good range. And that's, you know, a big part of why that's so important for workers who are going to be exposed potentially 8 hours a day, you know, maybe for 40 years. In the wildfire smoke setting, especially for the general public, you know, certainly it's incredibly important for us to work on, you know, doing what we can to minimize wildfire exposure risk, wildfire smoke exposure risk, and you know, change the course of wildfires in California. But in the meantime, the public has this exposure that they can't control. And while we can't expect that there would be a 95% reduction in exposure, an 80% reduction is going to take someone from the unhealthy AQI range down into the moderate range. And that's a big deal, especially for folks that are particularly sensitive. In contrast, a medical mask or surgical mask, if you expect about a 20% reduction in exposure using a medical surgical mask, depending where you are in the red unhealthy range, it'll either bring you lower into the unhealthy range or maybe even into the unhealthy for sensitive groups range. Slide. One caveat to everything that I just said, you know, certainly when we talk about the potential for kids to use a respirator and have benefits from it, we're talking about children who are awake and who are older than age 2. We would want that child to be able to tell you if they have a problem with their mask so you can take it off. This would only be appropriate for a child who's not going to pull on a mask or choke themselves with it. And really, you know, if they're young, they need to be supervised by an adult for all of those reasons. Go ahead and change slides. All right, so I went through that relatively quickly, but in summary, 3 main points. One is that children are uniquely vulnerable to wildfire smoke because of their differences in physiology, the fact that they're continuing to grow and develop, and because they have behavioral differences. The second is that we have known health effects of wildfire smoke for children, particularly respiratory effects, but we certainly have, you know, concerns that chronic and repeated exposure may have effects that we don't know about yet. And that so far the data suggests that in the general public, you know, reductions of somewhere in the ballpark of 20% of exposure are possible with surgical medical masks, and somewhere in the ballpark of 80% reductions are possible with NIOSH certified N95 respirators. That's all I've got.
Thank you so much, Dr. Holm. You answered some questions that we receive very frequently at CDPH about mask usage and effectiveness. Now we're going to hear, next slide please, from 4 speakers regarding guidance, tools, and actions for protecting communities from wildfire smoke. Dr. Rish Vadanathan is a senior health scientist with the National Center for Environmental Health at the Centers for Disease Control and Prevention. Rish has several years of experience planning, coordinating, and implementing strategies to conduct environmental health surveillance and translational research projects for elucidating adverse health impacts from air pollution and climate-sensitive exposures. Specifically, he's been able to establish mutually beneficial collaborations with academic institutions, state and local health departments, and federal agencies on efforts to identify and characterize populations vulnerable to smoke hazards from wildland fires. Thanks so much for joining us, Rish. I know Rish is going to control his own slides, so it may take you a second to set that up. All right, take it away.
Can you guys hear me okay?
Yes, now we can. Welcome.
Okay. All right. Thank you. Thanks so much for this opportunity. So it's great to present in this session, especially having heard like all the great talks before me. I just want to, describe the structure of my presentation. So primarily, I'm going to be describing the the work that we do at CDC regarding wildfire smoke exposure. But this presentation is catered towards like looking at it from a response angle. Like, so basically my observations from a creek fire incident that happened, that's happening actually, and it's deployment centric, but then there are several public health information that can be shared from this response. And before I go further, I just want to acknowledge some of the work that the Climate and Health Program, which is housed within the Asthma and Community Health Branch, does. And I guess like I put the slide up there just to reiterate the importance of wildfire episodes in a climate change context. So, you know, we know like air quality has been improving significantly over 30 years, except for the emissions that are coming from wildfires. And as I said, like in the context of climate change, we know that the average length of the wildfire season has increased significantly over the last few years, in fact, last 30 years. And also warmer and drier fuel leads to like more frequent periods with flammable fuels, which, you know, again, create conditions for large events like we're seeing this year. And I put up this slide just to, you know, reiterate that, you know, we do this with support and assistance from other agencies and other partners. So our work, which is geared at wildfires, you know, both pre-wildfire, during, and after wildfires, you know, is drawing on expertise and help from several partners. And primarily, like, you know, we work with federal agencies on exposure modeling effort, epidemiologic assessments, and several, you know, health surveillance and health informatics activities. And also, the way we make sure that the work that we do is relevant to our stakeholders is basically we constantly get input from state and local health departments on what makes actual impact in terms of our smoke and health activities. So just to describe the creek fire incident, like you guys have actually felt the smoke from that incident. So, and just to sort of lay out some of the geographical parameters that were in consideration. So it started like September 4th, and it's still going on. And as of like earlier this week, like, you know, again, like more than close to 400,000 acres with only 70% contained. So, but I just want to draw attention to some of the communities that are near you know, the fire perimeter and then the actual impact from fire. So these communities, you know, are the most impacted by the smoke from fire, from creek fire. And if you look at, like, you know, they're not huge population centers. Obviously, the smoke can travel far downwind, but the communities that are experiencing the brunt of the air quality impact is nearby. And if you look at the number of people residing in these communities, we have close to 40 to 50,000 people. And then another important consideration here is when the smoke goes to, let's say, a nearby park, like Yosemite National Park, you have transient visitors, like, which could range anywhere between like 10,000 and 20,000. So the exposure, when you look at exposure or the person days of exposure or the population level exposure, it could be significant in terms of how many hazardous days one encounters and like how it's sort of impacting health for those communities nearby. And so my role in this deployment was as an air resource advisor. So I was deployed to support the interagency wildfire air quality response program. And, you know, we essentially work with the wildfire incident management teams as a public health resource. So we're situated within the response, and we work closely with the incident meteorologists and the fire behavior analysts and other folks who would be helpful in predicting smoke in general, and also looking at emissions from that's coming from the fire. So before I got there, you know, there was considerable amount of work being done in terms of prepping the smoke aspects of this response. And as you can see, it's just not the smoke that was impacting communities. So for instance, like, you know, we did notice like all the debris and all the ash fallout like that you see here those are concerns as well. But primarily our role, or the role of an air resource advisor, was to look at smoke issues, smoke exposure issues, including like how we sort of assess a population level smoke exposure for communities nearby. So in terms of what we did, given we're in a pandemic, we had other public health response related duties as well. And in addition to measuring smoke in communities, we were also impacted by other issues such as, we had higher level of carbon monoxide. This is ambient carbon monoxide in fire camps and in places close to the fire line, as well as we had issues with compounding hazards. For instance, we had several days of extreme heat, which actually impacted both the response efforts and in terms of and also sort of the actual fire characteristics, which again contribute to smoke. So in terms of our exposure assessment, I just want to point out the way we do this is more like a micro forecasting. So it's not like we're predicting for the entire California region or the entire Western US. It's highly focused on the communities that are of interest. So we draw information from various resources. For instance, we understand where the hotspots are, where the active fires are, and then in combination with information on weather, transport, and models and other air quality resources, we're trying to get a picture of what the air quality is going to be for a given community on that day and then the next day as well. So a majority of our work relied on actually examining, where the smoke drainages were and then how it got into the valleys. So a lot of real-time observations are critical. So be it using webcams to understand where the smoke actually goes and settles in the night, and then also to understand any patterns in air quality driven by topography, terrain, and also transport and weather patterns prevailing during that time. So all these helped us synthesize information on what the air quality impacts were. And then this is my summary of air quality for the various communities impacted by creek fire. So it's very obvious, if you look at about 20-25 days, and I was there from September 20th through the 5th of October, it's still going on. So you could see several days of poor air quality. This is if you're a community, having 4 or 5 continuous days of, hazardous or even higher levels, or unhealthy or even higher levels, it's unbearable. And this also gave me kind of a window into some of the problems that a community faces, because very rarely you tend to understand how difficult it is to sort of stay inside. And when you come out, you do inhale the heavy smoke. So that's sort of my impression is one of the things here is we are predicting, even before we say what's the concentration of PM 2.5, what's the concentration of various pollutants in the air, our first understanding is where the smoke is going, what are the levels or what communities are immediately impacted by smoke. And another important factor here is North Fork, which actually is also home to the fire camps. So if you're looking at fire line exposure, which is inevitable, so for all the firefighting resources, you are exposed to really high concentrations of smoke. But then when you come back and rest in these fire camps, if you have higher levels of air quality, that sort of interferes with your ability to recover and also sort of adds to the overall cumulative exposure. So those considerations were important. And then we were able to sort of understand in terms of a person day approach, so what could be the potential health impact. So we haven't gotten that far, but it is possible for us to sort of understand, if you have 30 days of really bad air quality, the health impacts are going to be fairly significant. Just even the acute nature of exposure, as well as maybe long-term considerations to some of the exposed populations. And in terms of the highlights from some of this or public health challenges that were observed based on this deployment, we could sort of understand like what was happening at the community level. And then we were able to produce, so the outlook that you see on the right-hand side of the screen basically describes the way we approach smoke. So we understand fire is important. So we give some information on like, what's happening with the fire, and then smoke, and then any other special considerations we could potentially give. So given, we had a lot of questions related to smoke and health in some of the public meetings and also related to COVID, we were able to provide those information. So we had links that we were able to share with the safety and other medical unit for the fire. And also it was important for us to work with the air pollution control districts on some of the predictions we were making. And so it was kind of a collaborative effort in terms of getting input from them and sort of like getting their perspective on weather and other emission scenarios, and sort of using them to sort of fine tune our forecast. That was critical, and that was very important for us to have a discussion with the air pollution control districts, and also important to collaborate and understand what's happening in the park, given it was drawing a lot of visitors. And for some time during when I was deployed, like there was like a park closure, so we had to like sort of give information relevant to smoke that was going to be prevalent for those days in the Yosemite National Park. And also I want to highlight some of the other things we were able to encounter in terms of public health challenges. Like one was extreme higher values or higher ambient concentrations for CO, which I think we thought was just like basically coming from a local source, but then upon like examining and then actually measuring, it was indeed like, something related to the fire. It wasn't like a local source that's spiking the CO monitor. So things like that. And then also in terms of challenges, I want to highlight like, just having a forecast, a local forecast in a complex terrain or in a mountain meteorology is really paramount here, understanding. And so we were like, again, like doing our best, but then we're able to fine tune our forecast as we learn more about like some of these issues. And then another thing I want to mention is quantifying the smoke impact from planned firing operations. So when I say planned firing, it's basically a way for the fire service to sort of mitigate like a raging fire. So in that situation, we're adding to the smoke that's already there, but then that's a necessary, operation. So things like understanding how that smoke is also going to like, impact some of the nearby communities was a challenge for us, because it would be, we can, as someone in the fire response said, it's important to do this, but then the time that we get to understand like where the firing operations will happen versus like how that'll impact smoke, that understanding we were like able to like, only get like as we got a good sense into some of the necessary firing that was done in various parts of the fire perimeter. So those aspects in terms of working with the fire side of the response, that was critical. And then also when we were there, like smoke from multiple fires. So these communities, we were predicting smoke from the Creek Fire, but we were having instances where smoke from several other fires in California sort of was having an impact in some of these communities. So that, again, like was critical for us to understand. So, and we constantly monitored situations in other fire as well. And lastly, I just want to mention like about some of the compounding hazards. So when we have extreme heat events during fire response, that's again like interfering with some of the response activities as well. And it becomes like, especially in terms of a firefighter recovery and health, it's limiting some of the resting patterns, like you would have like on a typical day if it's really extremely hot, and then during the fire, if you're near the fire line and if you see a lot of if you're like exercising a lot, and that leads to a lot of other issues as well. So it was important for us to consider those things as well. And lastly, I guess like, I just described my observations. So it's important for us to understand these, fire responses and how when you're like looking at a nearby community that may be quite different from a far downwind community in terms of smoke exposure. And there are like several environmental and occupational risk factors that are in play. And both are, sort of, even though you may look at these firefighter exposure versus community exposure differently, in terms of like if they're like located, like for example, fire camps are located in the same community, or which is experiencing really high air quality levels, then that becomes, like a sort of intersection. So that's important. And then also I just want to, reiterate some of the work we're doing with Forest Service outside of the response, realm is also sort of important for us. Like, so for example, we're looking at health impacts of wildfire smoke and looking at it like both from what's happened when you have a wildfire and how smoke is impacting health from a wildfire versus prescribed burning, and how prescribed burning is one of the tools that land management agencies use to mitigate wildfires, but also, those generate smoke. So those issues, like, in terms of like how smoke sort of impacts, communities from various types of fires, that's also something that we work on. So I guess in all, the point that I want to make here is it's important for us to, understand exposure even before like we sort of predict what the health impacts are, or, even project health burden. So I guess like these deployments or these micro forecasts or the opportunities to do micro forecasting and get an understanding of exposure in communities, gives us a better understanding of like how we could sort of, expand into a much bigger area or like a much bigger domain such as the Western US. I think that's all I have. And then this was kind of like, how bad the air quality was. Like, and this is one of the best views. I mean, I've seen this place when it was, amazing, like clear. And then on a day where we had a lot of smoke, it's just hardly none of the peaks are hardly visible here. So again, like it's also important to look at some of the degradation in terms of the environment, like, and then also look at like, in terms of a tourism aspect to this, like where like, you don't want people to be exposed to smoke when they're visiting national parks, but then it's amazing. Some of these landscapes are like so amazing that even when they're smoky, they're beautiful. Thanks. I think that's all I have.
Thanks so much, Harish. Really appreciate that. We're a grantee of the CDC Climate and Health Program, and we really value the resources and support provided from that program. So we're glad you could join us from CDC today to discuss your deployment in California. Now,
thanks for having me.
Thank you. Our next speaker is Amy McPherson. Amy is the first Public Information Officer at the California Air Resources Board, dedicated to public education and outreach, as well as media relations for prescribed fire and wildfire smoke. Amy works closely with federal, state, regional, and local partners and other key stakeholders on interagency communications and public outreach regarding the impacts of smoke on air quality and public health. Welcome, Amy.
Thank you. So my name is Amy. I am not just presenting as a staff person at CARB, but also as a member of an interagency smoke communications group that came about earlier this year. And I'm going to talk to you a little bit about how that happened and how this kind of impromptu discussion turned into a really productive working group, as well as some of the resources that we as a group have identified as being really helpful in terms of public outreach. Unlike so many of the brilliant people we've heard from, I am not a scientist, so I'm going to take a kind of high-level communications public outreach approach to this. Go ahead, next slide, please. So earlier this year, I was at the Air and Land Managers meeting, which is just a meeting that brings together staff from federal, state, and local land management and air quality agencies a few times a year, just to get in a room together and discuss primarily smoke management issues that are related to land management activities such as prescribed burning. As our meeting in May was wrapping up, the group took some extra time and we stayed, I think, about an hour after the meeting was over to talk about public information needs and concerns in preparing for the upcoming wildfire season. We knew that it had the potential to be a really bad fire season, and unfortunately that proved to be the case. On on top of that, we were also dealing with the pandemic, and at the time was still very much at its height. And we felt it was really important to coordinate our messaging and in terms of what we were talking about with the public and the information we were providing the public to protect themselves. Next slide. At that time, it was really clear that more discussion was going to be helpful. So we pulled together a small group, mostly PIOs and other communication staff the following week. We found the discussion to be really productive, and we've been meeting every other week since May. The group consists of over 50 people representing at least 16 different organizations, including federal, state, and local government, California's local air districts, as well as a number of stakeholders. These are just a handful of them. We are kind of constantly adding as needed to this group, and one of the things we have identified as a need moving forward is a public health perspective. So that's something we're working on right now. Next slide. So when it comes to smoke messaging, and in particular the content we're generating to help the public, this is kind of a look at our key priorities. Clarity and consistency are needed to avoid confusion. And as a group, we've worked together on a number of projects. Individually, our different agencies and departments have worked on various public outreach projects and materials, and then what we typically do is share them with the group for feedback, any potential suggested edits, to raise any red flags if there's messaging that contradicts each other. And again, this is just to really, there's so much information out there, and people have access to such a wide variety of information from a wide variety of sources, and we want to make sure that we're all working together interagency to provide consistent information that's actually helpful to people. Next slide. So the first project we really worked on as a group was US EPA's fire and smoke map. Some of you may have seen or used this when the smoke was really bad earlier this year. In addition to the network of regulatory air monitors used by AirNow, the folks at EPA also added a map layer for the low-cost purple air sensors. They worked really hard on a correction factor that's applied so that the data is more consistent with the regulatory monitors. One thing you'll notice if you go to Purple Air's map on their website, their sensors tend to read much higher than our regulatory monitors. And there are a lot of reasons for that. But what EPA did was they worked with Purple Air, air districts, CARB, number of different people to apply a correction factor to this map in particular, so that it's not confusing for the public, so that it kind of adjusts those monitors to be more in line with the regulatory data, to be a little less misleading, and to just be more helpful. So one thing we talked about extensively within the smoke communications group was how to promote this product with the public. It's by far the most comprehensive look at smoke impacts and fine particulate matter during wildfires. We found the public wasn't really aware of it. A lot of people were going to AirNow's website and they'd hang out on the homepage, but they weren't finding their way to this map. So if you go to the AirNow website now, you'll notice that the fire and smoke map link at the top of the page is red. It's a lot easier to spot. It's much more visible. And that was a recommendation that came out of this group discussion that we had. We also worked with each other to amplify AirNow's social media content from promoting use of the map, which reached probably, I think it's safe to say, millions of people. And EPA, forgive me, I don't have the exact analytics, but the amount of people who started pulling up this map and using it went through the roof this wildfire season. And as someone who handles a lot of press calls, one question that I and others in the group often get from reporters and the public is, what's the best source for me if I'm looking for air quality information and smoke information quickly so I can make a decision for my family? What's the best place to go? And because we'd had these discussions beforehand and these robust conversations, we were all federal, state, local departments able to consistently point people to one place, this map, and hopefully minimize some confusion among the public. Next slide, please. So meanwhile, at CARB, I'm going to put on my CARB hat for a minute, we revamped our social media campaign with some new infographics for this wildfire season. We had some of these made already, but given kind of the complicated situation we were in with COVID, we really wanted to clarify a few things, revamp some graphics. And with so many people working from home right now, and with a shortage of N95 respirators due to the pandemic, we knew how important it was going to be to provide the public with information on how to keep the air inside their homes clean. And this is something CARB has done for years, but we really wanted to simplify it and make it much easier for folks to wrap their head around it. So once these graphics were ready, we ran these extensively through our folks in our research department, a number of other units within CARB. So once these were ready, I shared them with the smoke communications group, as well as the local air districts. They're also available in Spanish, and invited them to share them on social media. These were very much designed for the web and social media. Next slide, please. So we launched this new campaign on August 24th of this year, and we saw an immediate response on social media, thanks in large part to the collaboration established with other members in the smoke communications group. We put out 6 tweets that day, each one with a different infographic. They reached more than 50,000 people, and more than 1,000 of those people engaged with those tweets, which means they actively liked the tweet, shared it, or clicked on the link that we provided within the tweet to our website. For those who are not well-versed on Twitter analytics, every engagement with a tweet then appears on the feed of that user's followers. So if you click on a link, or if you share, like or retweet something, it immediately shows up. All of your followers immediately see that you did that. So conservatively, if we assume each person who engaged with our campaigns has, say, 100 followers, that's another 100,000 views immediately just for liking a tweet. And it just grows exponentially from there. The tweet you see on the left here reached more than 40,000 people alone, thanks to the governor's office and Senator Dianne Feinstein, who both shared it with their followers. Next slide, please. I'm going to quickly go through a few more resources we've talked about extensively in the smoke communications group. This is another product that was shared with that group. It's a fact sheet from the Santa Barbara County Air Pollution Control District. They get a lot of questions from their community about creating a clean air space indoors, especially they're in a coastal community where a lot of people don't have central air. They don't have a way to filter it through their home, so they have to either pick up a certified air purifier. They get a lot of questions about these homemade box fan filters. And so they worked with us, they worked with their own health department, and put together these fact sheets, shared them with the group, and I know a number of our other departments and members have been able to use them with their with the public in certain situations. So that's been a really handy resource. These fact sheets really useful because instead of just saying, hey, stay inside when it's smoky, they're actually helping people understand what they can do inside their home to protect themselves. Next slide, please. Number of other great resources. We talked about a number of these in the previous presentation, so I'm not going to spend a lot of time here. The Wildfire, Smoke, and COVID-19 webpage, an FAQ document that was developed earlier this year. I know the Air Resource Advisor program at the Forest Service was very heavily involved in this. Great information there. The Wildfire Smoke Guide, I'm pretty sure everyone in this group is probably very familiar with that. They got back together this year, including CARB staff, to put together some post-publication updates, which includes additional information and guidance specific to COVID-19. And last but not least, the US EPA Smoke Ready Toolbox has a lot of great fact sheets and other resources that help with public messaging surrounding wildfire smoke. And those are great if you don't want to share the direct. If you find a document and you're like, there's some great information here, but I'm not sure what to do with it, you can take it and create your own graphics or web content or whatever it is you're looking to produce. But it's really great information that's easy to find. Next slide, please. Also, the California Smoke Blog is a great one-stop shop for smoke information. It's a little little more, what's the word I'm looking for? Can get very technical, but it's really good information. A number of different agencies and departments contribute to the site. Again, it's a blog. It's not an official government website. But Air District staff, Air Resource Advisors with the Forest Service, a number of other people contribute to this content. Keep it up. There's a really great tab at the top called Smoke and Health that has a lot of relevant fact sheets broken down by topic. Again, if you're looking for something quick and you're trying to find the right information, I know the folks who maintain this website are very diligent about making sure everything here is up to date. Anything that's been updated or revised gets, the current version gets posted here almost immediately. So this is a really great source of information, and I think you'll see a lot more of these partner groups contributing to this website as we move forward. Next slide, please. Thank you. So with wildfire season hopefully wrapping up soon, the Smoke Communications Group is going to be turning our attention to prescribed fire season, just starting to ramp up, if you will. So smoke from prescribed fire, typically less intense, slower moving, more localized than smoke from wildfires. And because a prescribed fire is carefully planned, they provide an opportunity to prepare for smoke impacts. Again, this is going to be a weird year because the wildfire season was so intense and produced so much smoke this year. There's already a lot of resistance to the idea of putting more smoke in the air, even if it is less intense, shorter duration. People are just sick of smoke. So it's going to be a messaging challenge. We know we need to do more prescribed burn from a big picture from a big picture perspective to help mitigate and prevent wildfire impacts. But it is a tricky situation this year. So we're going to get together and really start digging into some common messaging, again, purely to help avoid confusion, make sure we are providing information to the public that is useful, as well as some new fact sheets, potentially infographics. We have a number of ideas that we're going to really start digging into here in the next month or so. Speaking of prescribed fire, the photo on the right here is one I took at a prescribed burn last fall. I was fortunate enough to spend some time on the Yurok Reservation with our next presenter, Margot. She and her team at the Cultural Fire Management Council led their annual prescribed burn training last October, and it was really, really fantastic to be up there with them. So with that, that's all I have, and I believe Margot's up next.
Thank you so much, Amy. Those were great resources. The AirNow app was absolutely indispensable this summer and fall, and we at CDPH are looking forward to sending a CDPH representative to the Smoke Communications Group. Next slide, please. And you gave us a great lead-in to our next presenter. Margot Robbins is the co-founder and executive director of the Cultural Fire Management Council. She's one of the key planners and organizers of the Cultural Burn Training Exchange, TREX, that takes place on the Yurok Reservation twice a year that Amy attended. She's also a co-lead and advisor for the Indigenous Peoples Burn Network. Thanks so much for joining us, Margot. I've always wanted to join a TREX training, but don't have 2 weeks to spare for it. Okay, welcome.
Ayukui, Nicknell Margot Robbins. I come from the traditional village of Morik. Thank you for having me today. I'm very honored to be here. I would like to change things up a little and start my presentation out with a song. It is a song of thanks. And, you know, despite the predicament we find ourselves in with COVID and wildfires, there is still a lot to be thankful for. You know, we have, as the previous presenter showed, we have a comprehensive collection of data showing the effects of the wildfire smokes, and data drives change. And so our new normal doesn't have to be a long-term new normal. We can do things to change the course of our trajectory and make a difference for ourselves. We don't have to be passively accepting what is the new normal. We can make change. And so with that, I will go ahead and sing this song. Chuki let ma Chuki let ma. Chuki let ma. Chuki let ma. Chuki ha let ma walk le ya how. Chuki ha let ma walk le ya how. Chuki ha let ma walk le ya how. Walk le ya how. Walk le ya how. Wanna hey yeah. Walk le ya how. Umerm. Walk le ya how. Kuwage. Walk le ya how. Natamir. Chuki hale ma walk le ya how. Chuki hale ma walk le ya how. Chuki hale ma walk le ya how. Walk le ya how. The Cultural Fire Management Council is a community-based nonprofit 501c3 organization. We was established after a community survey showed that returning fire to the land was the #1 priority for our community. Not only is our culture dependent on putting fire on the land, but we were also worried about our elders and if they would be able to escape should there be a wildfire. We come from the Upper Yurok Reservation on the Klamath River, and there's only one road in and out of the reservation. Fire has been outlawed to the normal person for over 100 years, and our land is a tinderbox, high fire danger. New slide, please. Yesterday, we helped this elder to burn around his home to protect it from wildfire. You can see how close the fire is to the back of his house. You might also notice that he has he's putting fire from the bottom of the hill. The reason he's able to do that is because the top has already been burned. It's black and there's no fuel there for the fire to consume. So where he's putting it now will just go up and meet the black, and then it will die down and go out. This is a safe way to safeguard people's homes. Excluding fire is not the answer. What we need is controlled burns or prescribed burns. You can see in the background there are two people. One of them has a hose and the other has a digging tool, and so that there's water sources that can reach all parts of this burn. So we are supporting this elder and helping to safeguard his place. Next slide, please. This is a cultural burn that we did on, it was a significantly larger burn than the home protection burn. This was about 30 acres. And you'll notice that up on the top left corner, you can see the blue sky. Prescribed burns put up much less smoke than wildfire burns. And it acts as a wildfire prevention. This burn we was doing we were burning for hazel. Hazel is the frame of our baskets, and it requires fire in order to reproduce. So what we do is we have cultural burns to enhance the cultural important species, our food sources, our medicine sources, the animal habitat, and the basket weaving materials, and so that they'll be plentiful again. In addition to improving the quality and quantity of these important species, the fire also provides other very important benefits. One of the things is that it leaves biochar on the ground. So we are, when we do landscape level burns, 30, 50, 80 acres, that biochar that's on the ground, it's another name for it, of course, is charcoal. It acts as a filtering system for the water source. So it purifies the water. The fire also increases the amount of water that is reaching the water systems, reaching the creeks that are reaching the river. So when we have our hillsides thick with brush, they're sucking up all that water. And that's not the way the landscape is supposed to be. It's not supposed to be so thick with brush that you can't walk in the forest. And that's not how it always was. Back before the fire suppression or fire exclusion area, Native people burned on a regular cycle. They didn't burn the whole landscape all at once, but they would burn smaller patches. They would burn, the women would burn their hazel patches. The men, when they came off the hill from hunting, when they would look, they would notice different cues that tell them that, okay, this fire is, this piece of land is ready for fire again. And so they would light it up as they walked back down the hill. And in that way, it kept the brush, and also known as fuel load, the brush down. And there was not these big wildfires that we are experiencing today. Next slide, please. The Cultural Fire Management Council does a couple of different kinds of burns. One of them is the broadcast burn, where you are putting fire over a large area of land. And that's the most healthy way to do fire. So it burns up the brush, it rejuvenates new healthy growth for the animals to eat. And it also is good for the water. The biochar also improves the soil. It makes the soil more healthy. So these two people that you can see here are putting fire on the ground with drip torches. And this is part of what's known as a Trex burn. And Trex burns, it's done with qualified firefighters. They come from all over the United States and sometimes other countries. And they are there to increase their firefighter qualifications and also to learn about prescribed burning. We also share some of our culture with them so that they know that what they're doing is much more than just burning brush, that what they are doing is actually contributing to our ability to carry on our cultural lifeways. Next slide, please. Sometimes weather doesn't permit us to do broadcast burns, and so we'll do pile burns. And so this was a pile burn that was up by the tribe's communication tower, and they were afraid that if fire went through there, it would destroy the tribe's communication system. And so we were asked to burn these piles for them. Piles is not our preferred way of burning because it burns so hot in one place for so long that it can be harmful to the soil, can actually kill the soil for a period of time. But sometimes that's your only option. Next slide, please. Another thing that we are doing is family-led burns. So you can see here 3 generations of people doing a burn. This is a traditional way of burning that each family, each tribe would burn their own areas. And so with doing that, the entire landscape was taken care of. This was a burn that we did on my property, and we were teaching the kids to start at the top of the hill. That when you start at the top, the fire just slowly backs down the hill, and then that's how you're able to control it. You might notice that the kids have little torches in their hands, and those are made with wormwood, a traditional wormwood torch. And so we're explaining to them, you know, how, not just explaining, but allowing them to learn through actually doing it. And so that when, you know, we're not going to be here forever, but when we're gone, our kids and our grandkids and the generations after us will continue to take care of the land with fire. Next slide, please. This graph was provided by Leland Tarnay. He's a physical ecologist with the U.S. Forest Service. And it shows the comparison of the levels of smoke from wildfire versus the Trex burns. As you can see, there is a significant difference between the amounts of smoke. During this past wildfire season, the smoke was so thick where I live, we couldn't see across the river. And it was like 2 or 3 weeks like that. We just mostly had to just stay in our homes with the air purifier on. And so I just wanted to demonstrate that the prescribed burns, that it is much less smoke, it is localized. And I put this slide up here for people to really think about choosing your smoke. You know, there's not an option for no smoke. Will you choose the minimal amounts of smoke from wood, from prescribed burns or cultural burns? Or will you choose the massive amounts of toxic smoke from wildfires? Because there will be fire. It's meant to be a natural part of the ecosystem. We can work with it or we can try to fight it. But as the data shows us, fighting fire is not all that effective. Next slide, please. There are many, many benefits to doing prescribed fires, as I mentioned earlier. Fire keeps our land in balance. It restores the health of the land, and the health of the land is connected to the health of the people. And so if we want healthy people, we need our land to be healthy as well. And cultural burning or prescribed burning is a big piece of that answer. We need to join forces, the government agencies, the tribes, the nonprofits, the private landowners. All of us can help be part of the solution. Fire needs to be put back into the hands of the people. Next slide, please. We can all be part of restoring the land with fire and protecting our homes from wildfire. We can all be part of the solution. Thank you so much.
Thank you so much, Margot. It's an honor to hear from you today, and I thank you for teaching about cultural and prescribed burns to keep the landscape healthy, as its original inhabitants kept it for millennia, and as you say, a healthy landscape leads to healthy people. And also, thanks for bringing up the role of biochar in a healthy ecosystem as well. I want to remind folks that our June 2019 Public Health Work Group focused on wildfires, climate change, and health as well. And Leland Tarnay from USDA Forest Service was one of our presenters at that time, also talking a little bit about prescribed burns, but not from the cultural burn perspective. So our next speaker was going to be Armando Elenes, the organizing director and secretary treasurer for United Farm Workers. Unfortunately, Armando was not able to get away from another meeting he's in that went over, so he will not be joining us today. So we will go right into discussion facilitated by Bunny Holmes-Dunn, Chief of the Health Exposure and Assessment Branch in the Research Division of the California Air Resources Board. I'd like to remind folks to make comments or ask questions. Please use either the WebEx chat or email CHEP, that's CCHEP @cdph.ca.gov. Go ahead, Bunny.
Hey, I guess I can say good afternoon. I'm really glad we have a nice chunk of time for questions and answers and discussion. We're going to start with a couple of questions to the panelists, and we could possibly try having folks put on their videos. I know we were worried about bandwidth. I just wanted to say to start out that this has been an incredibly informative set of presentations on wildfire and smoke impacts and tools. And while it's sobering to see and be reminded of the many health impacts and the massive increase in fires, the new normal that we're experiencing, it's very inspiring to hear about all the collaborations and the tools, the mapping tools and the outreach tools that we have available, and to think about these important tribal and cultural perspectives on the role of fires in our ecosystems and in our communities. So I think we're all inspired by this rich set of presentations. So just wanted to start with a couple questions to the panelists, and then we can invite others to jump in if they have responses or other questions. And so, looking at, we've had a discussion about lots of different health concerns, acute impacts, occupational exposures, chronic effects from recurrent wildfires, these effects, the effects on children. We've talked about, respiratory versus cardiovascular and other emerging effects or emerging research on birth outcomes and mental health. Just looking at all of this, I wondered if we could get a few responses from the panel members, whoever would like to jump in. What's the biggest health concern we are facing with increasing wildfires, and what gaps in health information need to be filled? So I'll just see if anyone wants to jump in, and if not, I might call on you. All right, how about, is John Baum still on the line? Is he still in our meeting? Or Barbara Weller? Maybe ask some of our initial panelists.
I believe John and Stephanie had to sign off at noon, unfortunately.
Okay, all right.
Hi, this is Barbara Weller. I was waiting for John to respond. He was here. But I think from my personal perspective, and I think maybe the talks that we've heard today has really brought this out. Our biggest public health concern is that, more and more of the population are being impacted. And I think it fits in with the gaps in the health information. We know that some of our population are much more vulnerable than others. But we don't have a lot of really strong information about that. So I think this idea of the new normal of wildfires that are longer duration needs to be looked at, and I think that really a lot of information has been gathered from studies of wildfire, but I think there's still quite a bit more to look at, and particularly looking at some of the vulnerable groups, some of the sensitive populations within our state, to be sure that we're doing everything that we can to protect all of our citizens. So that, from my point of view, that would be the public health concern and the gap that needs to be filled.
Okay, any other folks want to?
This is Sue. Could I add a few things to that?
Yes.
I think that given what's been said, that having better and more accurate information about the interventions that can be done, how people can protect themselves. Better information about portable air cleaners and filters, and upgrading areas like schools and filtration systems. But that's an area that we're going to need to really focus on. And in addition to dealing with the heat question as well.
Right.
I wanted to mention that was Sumi Hoshiko from CDPH, and also Rupa Basu and Mark Miller are available to chime in perhaps if they like. They've been made panelists if you want to answer the questions as well.
Yes, thanks, Linda. Yeah, we've broadened our set of panelists. We had a couple have to leave, but we've had Mark and Sumi and a few others have been with us, our important experts, and have been with us throughout this session this morning. Other thoughts on the biggest health concern and the gaps in health information that need to be filled? I think I agree. I think we've all, we've talked about people need to understand more about this new normal, how it's going to affect them, have better information on tools, air cleaners, ways to keep them clean air spaces, ways to keep themselves safe for families and children, how to keep themselves safe during these fires.
Bonnie, this is Meredith, and one of the comments in the chat I think also addresses your question about the gaps, so I thought I would chime in and read that from Mike Jarrett about the health concerns of what are the chronic effects of repeated exposures, and also what is the impact longer term, even including indoor air quality when smoke comes in the home. And so I'm not sure if panelists want to comment on that. It also sounded like something where those are some of the gaps that need to be filled.
This is Margot. I would just like to say that the information on how the smoke affects babies and small children was really pretty startling. And I'm not sure, I know that there is a team of people getting the information out there, but perhaps that needs to be ramped up some, and to, work with more agencies to help get the word out there too. I have a 14-month-old grandson, and I told my daughter, gee, this smoke's probably, even worse on him than it is on us. And so I think maybe people don't always think about that it is more severe for young people than it is as adults, and in addition to it being really bad for adults. So thank you.
Yeah, this is Mark Miller. I just add one thing that's really been, I think, vexing, and that's the messaging about how to interpret the AQI for your activities. I mean, I know there's been a lot of work for school guidance, but pediatricians and families and they're still not very clear. The guidance for schools sometimes is conflicting even within the same document and across different places, and even when it's there and it's not conflicting, people don't really know. They still have a question. Well, what does this actually mean practically?
Mm-hmm. Mm-hmm.
I think we need to continue to work on that.
Great. Go ahead. Messaging on how to interpret the AQI guidance for schools can be conflicting. I know those are important topics that we need more expert input into that. Next up, who has a comment?
Yeah, this is Margot again. We actually I also work for the school district, and we always get every day the air quality information. And so we base, whether we are having school or not on that, well, in addition to COVID. But, speaking of building partnerships to share information about the impacts, the schools would be a really good avenue to share out to parents. This is how it's going to affect your kids if you allow them to run around and play outside. and with that really specific information. So I just wanted to add that.
Great.
Hi there. This is Rupa Bassett from OEHA.
And I'll just go ahead, and then I'll just say if folks want to be writing it on the chat, if they have other responses they want to bring into this health piece, we'll stick with this for a little bit before we go to the tools. So feel free to write in some questions or comments on the chat around this also. Go ahead.
Okay, so I just wanted to say I think these presentations were very informative, and the CAT Public Health Working Group did an excellent job of organizing this. But what we're hearing over and over again is how new this challenge is for California. And, you know, while we've had wildfires in the past, we've never had quite the extent that we see now with the duration and the intensity and the season just being so far extended. So a lot of the information we have is very new, you know, so, you know, we have some short-term effects. I think Meredith mentioned we haven't really been able to study the long-term effects, because even though we have some longer-term wildfire studies, every fire is so different in terms of the populations that are impacted, the areas that are impacted. We're seeing that the fires are getting larger and larger and spreading very quickly and into very heavily populated areas. And so, you know, even the guidelines that we have for California are relatively new. We're basing a lot of that on the health studies that have been done, but like I said, there's so few that have been done relative to the recent wildfires that we have had. So I think we're building the evidence. We need more guidelines. A lot of people are unclear what to do when these fires hit, and you know what's okay and not, particularly with children. So I'm really happy to see all of this discussion coming into play here.
Great. Thank you, Rupa. Rupa Basu from OEHA. Very much appreciate that.
Sonia, this is Amy at CARB. As far as gaps, I think not necessarily a specific gap, but something we need to keep in mind is to make sure we're not working in silos. I think this group is a great example of kind of bringing people from different groups together, and I talked about it a little bit in my presentation, but we ran into some messaging issues at the beginning of wildfire season, just with different folks saying different things, not being able to get a hold of people in other agencies. So I do think it's really important that we recognize that though we work perhaps for different departments or governments or organizations, that we as public health folks are all on the same team. And I think we need to be talking together and sharing that information with each other more broadly, I guess, is what I'm looking for. So yeah, that's just my 2 cents.
Great. Hey, can I put you on the spot and then say, so do you have any specific suggestions for how we can get out of silos and be able to work more closely together on the messaging and outreach and consistency?
Yeah, I do think specific to messaging and consistency, I know I've reached out to a couple of groups. I do want to make sure we get CDPH on our smoke communications group. I think it's recognizing that when you sit down and you say, okay, I don't have this information, I need to go to someone, and you're tracking down something, right? You need to build a relationship building is really what it comes down to. Networking, relationship building, making sure you know who to call when you need something, making sure that when you're getting ready to put out a study or information, you sit down and think, okay, who is this going to impact? Who is this going to affect besides just the public? And making sure that those groups, those agencies, those organizations are aware of it beforehand.
Okay. Awesome. Yeah, bringing more organizations into the fold, relationship building. I think Meredith said there's some other comments in the chat that would fit in with this discussion. Why don't we mention those right now?
Yeah, there's some comments about it are sort of like gaps, but just, you know, decisions that are hard to make that better information would help. One being during a smoke event, whether it's better to close school and keep kids home or send them to schools, and what research can be done to help that. And another one about exercise. One of the participants said they have a family member who called their rehab nurse. Should they exercise or not exercise during the smoke? And she said that he should exercise. So there's a lot of hard decisions around those things.
Right. Any comments from the panel about some of those questions? I mean, these are questions obviously that we're grappling with in a number of forums, but I think we recognize the importance of providing clear guidance on these issues. But if anybody has any immediate comments to make about the needs for guidance on exercise and schools, when to close. Okay. Go ahead.
Oh, and similarly, there's some comments about the intersection with heat, and especially this year we had a heat wave and staying inside. And so there's different comments about messaging, what personal decisions, help with personal decisions. And then we've also gotten some comments about just, what is the research out there on the intersection with heat and the health effects.
Great. And I'll just say, just going back to the last question about guidance that, at ARB, and I know, as we heard from our sister agencies in OEHA and CDPH, and there's important research going on at all of our agencies to better understand, research that's going on and plan to better understand the health impacts we've talked about, and particularly to get at this gap that we just talked about, this gap in terms of better understanding the repeated exposures over time, the chronic health effects from these recurrent exposures. So I just wanted to say, we, at least at ARB, and I know at other agencies, we're very aware of this gap and currently looking at how we can develop research going forward to fill that gap. So I just wanted to make that point too. And then in terms of the intersection with heat, I think that kind of gets into our next question too also. How can we better assist communities that are dealing with these multiple threats? I mean, we can't, I think this has come up a few times in the chat, we can't just look at, unfortunately, we have a big enough problem with wildfires, but it's not just about wildfires. It's about the wildfires plus the smog, plus the illnesses we're dealing with the pandemic and the heat waves. And how do we provide tools to communities to deal with these multiple threats? And I think another question came up was, when we're doing research on wildfire health effects, are we taking into account, some of these combined effects, particularly smoke and heat? Are we looking at both of these things? So I'll just throw those couple questions out to the panel. Any thoughts, impacts on how do we provide information and tools for dealing with multiple threats?
I mean, I can kind of, sorry. I can mention that I believe there's a couple, with these threats, there's a lot of overlap in the vulnerabilities to wildfire smoke and smog and heat waves and COVID. And I believe there's a lot of good work being done with vulnerability mapping and identifying communities who would be vulnerable to these threats, and I guess relating back to the gaps, it's like further informing who's vulnerable to wildfire would help feed these tools and help decision makers make better judgments on where to allocate resources.
Great. Great. Vulnerability mapping. Others?
This is Sue. I want to say that there's really well-established literature on the dangers of heat waves and mortality. So we definitely know that, and whether that's exactly additive or whatever with wildfire, most wildfire studies now, we do put in a temperature variable to account for that. So we're trying to look specifically at the wildfire smoke effect. A lot of wildfires have been not in the middle of heat waves, actually, in California. So it's not necessarily been a big deal, but I think the equity issues are huge around heat, especially, you're in an air-conditioned house, then you're then you're way protected. And the people who don't have air conditioning, they're seriously at risk. And that's just an equity issue that has to be addressed, I think.
Thank you. It's important. We have to understand equity issues, and it gets back to better mapping and understanding vulnerabilities in communities across the state.
Yeah, and I'll add, this is Meredith, that there were a bunch of comments in the chat about those types of equity issues, and in particular, there's some questions about whether any of the speakers and the research that they presented specifically today looked at things like race and income.
Okay, that's a good question.
That is a good question, and this is Barbara Weller, and that certainly is what we're going to look at in all of these studies. I tried to emphasize that really virtually all of the studies, except for the study that has been ongoing for a while with the primate center, all of the studies that I've presented today are in the very beginning stages. But equity issues, looking at populations of color, is really a large part of the studies that I've presented today. But we have no results for those studies because they are literally just beginning.
And this is Brian. Just in relation to our specific study, the numbers, just because we were looking at a single event, were a little difficult for looking at more vulnerable exploring who's more vulnerable to these exposures. But it's traditionally something that we have tried to explore with general PM2.5 and heat studies, and it's something that we keep an eye out for in the future, and would hopefully be able to. It's hopefully something that would be able to be better explored with larger scale, like multi-fire, multi-year studies.
I think this is a question that I think we're all addressing in some ways regarding how do we include equity issues and concerns in our research. But I think that's something where we could benefit from more cross-agency discussion about this also, between ARB and CDPH and OEHA and others. Now, how are we addressing equity issues in this research on wildfire impacts? Are there other comments? And then someone mentioned outdoor workers, right? When we're talking about vulnerable populations. Mm-hmm. Meredith, okay, go ahead.
Sorry, this is Margot Robbins, and there are maps with the socioeconomic low income status. I know that when we did our CAL FIRE grant, we had to look on there to see if we was in one of those areas, and of course we are. So you can just look at those different areas and figure that the people who are living in those low income areas more than likely do not have N95 masks, more than likely do not have the air filters for their homes, and for sure don't have the ability to replace a home that they're living in. I know in our areas, very high unemployment, and luckily the tribe received some COVID monies, and so they provided air filters for the homes in our area. But that's the tribes. What about all the other people who don't have access to that? Who is providing those things for them?
Mm-hmm. Good, very important questions. How are we assisting communities dealing with these multiple threats? And do we have a sense of what's between state and local agencies? What kinds of resources are available or provided to help people protect themselves?
I'll chime in and say that regarding inequities and existing inequities, which often make the same communities vulnerable to smog and COVID-19 and heat, that are also vulnerable that have been disinvested in for decades to centuries, and unfortunately tend to be frequently more impacted by different health and climate exposures. So our tool of the climate change and health vulnerability indicators and are the CHVGs, and the visualization tool on our website that maybe one of my colleagues can put in the chat does talk about different climate exposures of extreme heat and wildfire risk, and for air quality exacerbation and sea level rise, and then also talks about population sensitivities, such as population above 65 or children or communities of color facing racism, and then also talks about lets people compare different adaptive capacities. So whether there's tree canopy versus a lot of hard impervious surfaces that absorb heat and block water absorption, or whether people have access to transportation to escape climate events and things like that. And yes, thank you, Dan, for putting the CHVGs in there. And then also, we also use the Healthy Places Index tool quite a lot, which are about 26 different indicators that that show geographically by census tract areas that have more health promoting factors or less health promoting factors, and those indicators are all correlated with life expectancy at birth. That's really rooted in health outcomes. And of those indicators, the economics indicators tend to be the strongest, having the most influence on health outcomes. So income and access to living wage job, employment, things like that. But it also talks about environmental exposures, neighborhood quality, access to healthy foods, air pollution, access to transportation as well. And then, of course, there's OEHA's virus screen, which is a wonderful indicator for looking at communities that are exposed to disproportionate pollution burdens, as well as some indicators on health outcomes as well, and socioeconomics.
Yes,
but we definitely need to improve our collaboration among all these and continue to refine them for their different benefits and drawbacks.
Yeah, and I think that we have a whole list of amazing resources in the chat, including all of these tools, Healthy Places Index, the climate change health vulnerability indicators. I think, and Dan just put up the CAT-PHWG screen. I know many of you are aware of those, but I think if we could get out to everybody the list of all the tools and resources that were included in the chat, then it would probably be incredibly helpful to everyone. And it's we do have a growing number of important tools that we can use, and we're using them at ARB. And CDPH and OEHA, I know we are using them, and we are, these tools have been really critical in making important decisions about how we're allocating resources in California, how we're allocating incentive funding for communities, how we're allocating, how we're prioritizing enforcement where it's needed better, and how we're there are important steps for us in addressing equity issues. So let's make sure that we do get the list of all the resources, including the tools, out to folks. I think, Meredith, are there any, I think we're at the 12:30 point. Are there other questions or comments that should be mentioned before we give it back to you?
There are a lot, so I think we don't have time, but I would say that we can write them up and send them to all the panelists. Maybe Dan can comment on that more.
Great. Yeah, if you could maybe write the questions up. I mean, I'm just looking a little bit in the chat. I think we've talked a little bit about the need for research on combined impacts. Yeah, we said we'll compile the resources and share personal air quality monitors. I do want to make sure folks don't forget that ARB does certify indoor air cleaning devices. So we do want to make sure that people that use those devices are not using devices that generate ozone. So let's also add to the list of resources the website to identify CARB certified air cleaners. We'll add that to the list also. Okay, thank you everybody for incredibly rich discussion. I think we've hit on some key next steps that we need to take moving forward. And I'll turn it back to Meredith. Sorry, yeah, Meredith, yeah. Or Amanda.
Thank you. Thanks, Bonnie. Yeah, so just in wrapping up, I do want to remind attendees that we do plan to post this meeting recording and the materials, such as Bonnie is recommending, the compiled questions and other materials, which will take about 1 to 2 weeks. And if you do have any questions or follow up in the meantime, please don't hesitate to send us an email at the address that's shown. And I just want to express our sincere thanks to all of today's expert presenters, our facilitators, and the staff at both CDPH and Air Resources Board who helped pull all of this together and keep things running smoothly. And finally, to everyone who joined today, so thank you. Take care of yourself and each other, and please enjoy the rest of your day. Thanks.